Welcome back to LAUGHH Foundation and our docu-series. We've been covering a lot of different subjects around COVID-19, and today we're talking about nutrition and how to improve your immunity. And we have with us Juliana Camargo. Dr. Camargo has her PhD in medical nutrition, and she's going to be sharing with us. Thank you, Juliana, for being here.
Thank you, Francie. Thank you, everybody, for having me here. It's my pleasure to talk about nutrition today. So Francie and LAUGHH Foundation invited me to be talking here about nutrition and how to improve our immune system during times of COVID. So we don't have a clear relationship on science about how nutrition can improve the COVID-19. What we do know is that nutrition can help to improve our immune system. But how does that happen? So nutrition can help us to prevent inflammation. So a lot of what leads to a poor immune system is inflammation. But how do we cause inflammation in our bodies if we have a diet that is not healthy? And what is an unhealthy diet? Is that a diet with high sugar, for example, ice cream, sweet beverages, processed juice, so juice that is already prepared, also high on the types of bad fat that we say, like the trans fat and the saturated fatty acids. Where we found that, we can find that in red meat, we can find that in frozen meals, we can find in cookies, and also a diet that is high in red meat, as I mentioned. So red meat can have good things, but mostly it leads to an unhealthy diet. But what can we do? What can we eat to have the opposite, a healthy diet? A healthy diet is rich in fruits and vegetables, but also on other types of food that are important. For example, legumes. So example of beans, chickpeas, and lentils are legumes that can help our diet. They are rich in fiber, that is very important for the immune system. They are rich in some minerals and vitamins that help in the immune system, such as iron and zinc also. And then they are a good source of protein. So if I say, oh, you should, avoid to eat red meat. So how can I substitute? You can substitute with legumes, and then with other type that is important, other type of food that is important also for the immune system, that are fish. So fish can be rich on the good type of fat that are the unsaturated fatty acids, such as salmon, tuna, sardines, and also the good type of fat that also helps in the inflammation can be found in the good oils, such as olive oil. So these are the basics of a healthy diet that we should be consuming now. I know that during the quarantine, sometimes we have food cravings, especially for candies and chocolates. I'm not saying here that we should not eat, but we need to control and avoid. And then, I was saying that nutrition we already know that can help in the immune system, so to improve. And then for people who already have COVID-19 that are being treatment at home, there are some topics that we need to touch that are important as well. So one of the symptoms of COVID is that people cannot taste or smell food, but it's important to remember that they should continue to eat. So for the body to recover, nutrition and eating is very important. Again, looking for a healthy diet and not candies and sweets and fats, but it's very important to help to recover. So even though people are not tasting or smelling, they should still continue to eat. So I'm available to any questions you may have.
Dr. Camargo, thank you very much. That was a very informative talk and gave us a wealth of information. Something I've been hearing a lot about is vitamin D3. Is there anything about that or anything about supplementation?
So vitamin D3 has been proven before that can help in the immune system by other studies with, for example, influenza. Right now for the COVID, we don't have guidelines saying that we should supplement vitamin D3 to prevent COVID. However, there are some interesting scientific data out there that shows that vitamin D may have an effect. I cannot say right now to supplement because we don't have guidelines, but we know it's important for the immune system. So what I would recommend as a dietitian is if you are already told by your physician to take supplements of vitamin D, even before, continue to take it. And then also another thing that is important to keep in mind is that now that we are in quarantine, we are staying a lot at home and in closed spaces. Vitamin D3 can be naturally produced by the body when we are out at the sunlight. So because we are staying a lot in closed spaces, it's important to remember to also, if possible, of course, with all the protections and that are suggested right now, but be a little bit outside at the sunlight because that can help to activate vitamin D3 as well.
Great, thank you very much.
Juliana, you told us to eat a lot of fruits and vegetables. And they tell us also to keep washing our hands. Is there something we should do with the food to keep it safe and keep us safe with the food that we handle?
Thank you, Kate. That's another topic that is very important. So right now has been shown that contamination by COVID cannot be done through food, consuming food, but we need to remember that touching and also contact can lead to COVID. So not that COVID will be given to us by food, but we need to keep the food safety, cleaning of fruits and vegetables. So again, wash your fruits and vegetables, do sanitize it, and then also remember to clean the silverware that you're going to use, especially if you're sharing with other people. So restaurants, we need to keep in mind that touching can lead to COVID. So keep food safety and cleaning, that's important. But there's not a different recommendation on how to clean or prepare foods.
Thank you.
Dr. Camargo, I have a question about fruits and vegetables as well. We know they're good for us. We've been hearing this our entire life, but fruits and vegetables mean I have to go to the store at least once a week, probably twice a week to keep them fresh in my refrigerator. And they're also telling us not to go out, minimize the amount of time you spend going out. So what can you suggest for someone who's trying to eat healthy, but also wants to cut down on their exposure?
Thank you, Paula, for the question. Yeah, so there are some tricks and some advices that we can have to reduce the amount of times we go to the grocery stores. So I was saying about fresh foods and fruits and vegetables. Ways to overcome that is, for example, choose vegetables that have a longer shelf life. So for example, instead of buying lettuce, we can buy kale, or we can buy Brussels sprouts, we can buy carrots, zucchinis, that they have a longer shelf life. We also can buy frozen fruits and vegetables because they have a longer shelf life. They will have a little bit less of nutrients than the fresh produce, but it's not that different. And then you can continue to have a healthy diet with fruits and vegetables and still not have to go to the grocery like twice per week or even more. Other example, milk. We can choose milk with longer shelf life. some people mention about canned fruits and vegetables. That is an option as well. I recommend as a dietitian to choose the frozen versions instead of canned. If you're going to buy canned, always remember to look at the food label for the amount of sodium. Sometimes canned food, to be preserved, they need to add a higher amount of sodium. So always check for sodium. And then for fruits, the amount of sugar, because we know that for some types of fruit, they can add corn syrup or sugar to preserve it. So that's why frozen is better, because when you freeze a food, you don't have to add anything extra. You keep with the nutrients that they already have, and their composition that is natural, is just frozen. But that is an option to reduce the amount of times that you go to the groceries.
Thank you very much.
Thank you.
Juliana, this has been such an informative session. I think everybody has questions, and we're struggling with what we've heard of as the COVID-19, and that being the COVID-19 pounds that everyone's gained because they're eating a lot of carbs and sugars. So thanks for your wonderful advice, and here's to our healthy immune systems. Stay healthy, stay safe.
Thank you.